Clinical signs seen in hyperthyroidism. Various clinical signs seen in hyperthyroidism include brittle hair or hair loss, warm, moist skin, tremors in extremities, enlarged thyroid, pretibial myxedema, brisk reflexes, diarrhea, increased heart rate and blood pressure, and menstrual cycle abnormalities. Although these signs are found in almost all patients, the degree of each sign may vary between individuals based on the level of thyroid dysfunction. Hair changes noticed are thinning and loss of luster. The hair appears straight and fine. In some individuals, alopecia is observed. Alopecia areata is an autoimmune disorder and is found to be associated with autoimmune causes of hyperthyroidism, such as Graves' disease. Excessive sweating, especially on the palms, is observed. The patient often has a raised body temperature and complains of feeling hot. These symptoms are postulated to arise due to the raised sympathetic activity, owing to raised metabolic function of the thyroid in hyperthyroidism. Vitiligo, although not very common, is observed, as it is an autoimmune disorder and is often associated with other autoimmune disorders of the thyroid. Several eye signs are associated with thyroid disorders, the commonest one being exophthalmos or Knapsager's sign. Other eye signs have been dealt with in a separate video. Excessive redness of the palms, also known as palmar erythema, and excessive sweating of the palms, is a common finding. Due to increased sympathetic function, tremors or jitteriness is observed in the extremities. Excessive jitteriness progresses into a constant state of restlessness and nervousness, making it hard for the patient to concentrate on any activity. Changes seen in the nails are as follows. In hyperthyroidism, there is an increase in the rate of growth of the nail as compared to the nail bed, which results in separation of the nail from the nail bed, called plumber's nail or terminal onycholysis. Catabolism of nail and nail bed proteins also contributes to the development of this finding. Thyroid acropathy is a rare complication of autoimmune thyroid disease. It presents as nail clubbing and swelling of digits and toes. Enlarged thyroid gland is a common feature in any thyroid abnormality. A goiter may be an overall enlargement of the thyroid, or it may be the result of irregular cell growth that forms one or more lumps, nodules, in the thyroid. Thyroiditis, which is inflammation of the thyroid, may also sometimes present with swelling. It mostly affects women from early adulthood to middle age. Pretibial myxedema is also called localized myxedema, thyroid dermopathy, or infiltrative dermopathy. It is an infrequent manifestation of Graves' disease. It forms the third component of the classical triad of Graves' disease, which is goiter, orbitopathy, and pretibial myxedema. However, it is not restricted to the pretibial area, and may involve the ankle and dorsum of the foot, and may present on the elbows, knees, upper back, and neck. Excessive jitteriness and tremors are also a feature of the limb manifestations. Due to sympathetic overdrive, the lower limb reflexes, such as knee and ankle jerk, are brisk. Sympathetic hyperstimulation leads to increased bowel movements, resulting in diarrhea and malabsorption. The patient often complains of increased hunger despite having a good appetite, along with weakness and weight loss despite having an increased appetite. All these symptoms are often interrelated. The sympathetic overdrive has a positive inotropic effect on the heart, resulting in tachycardia. Atrial fibrillations may be observed in extreme cases. Often it is associated with thyrotoxicosis or thyroid storm. Increase in thyroid hormones indirectly causes a rise in sex hormone binding, globulin. This protein is known to inhibit ovulation, therefore causing amenorrhea. As a result of anovulatory cycles, fertility is reduced, and chances of miscarriage increases. Gynecomastia is also seen in some males. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.